Welcome. I'm so excited about this conversation. Thank you so much for being here. This is Dr. Bruno Rasmussen calling in from Brazil. And it is just such an honor because of not just because of what you've offered to the Ibogaine community and quietly done over the past 30 years serving this medicine, but also because you're just a delight. And I had such a great time
Mhm.
at Philadelphia chatting with you and before. So thank you so much for being here.
Thank you. Thank you for the invitation, for the opportunity. I like a lot to talk about Ibogaine, so I think I am at the right place.
I think so too.
Yeah, thank you.
Yeah, yeah, we barely got to scratch the surface in the Philadelic conference. And so this is just an opportunity to fill in a little bit more of the incredible work that you've done. I know that during and after the conference, I spoke to Dr. Maurice Hinson, and he said that much of his research came from your work, which is incredible. So you got to present your work as well as speak a bit about the experience being in Brazil and serving. And technically, Ibogaine's never been scheduled there. Has that always been the case?
Exactly. Ibogaine it's not scheduled in Brazil, so this open a window of opportunity for us to work with it. There are some rules that we must follow. Our FDA is called ANVISA. So ANVISA has these rules that we must follow. And the main rule is that we cannot have Ibogaine with us here at the office or at the hospital. We need to buy the medicine in the name of the patient. So when the patient decides to do the treatment, we must buy it. It takes around 4 weeks to arrive it because it goes through customs, it goes through visa at the airport, and after that we can do the treatment. So officially, Visa doesn't recognize Ibogaine like a medicine, but it respects the doctor's decision about the treatment and the patient decision. So obviously, we cannot give Ibogaine to the patient without the consent of the patient. But when everybody is agreeing that it's a good thing to do, Anvisa simply let us work and don't disturb this. But we don't have authorization to have it in stock at the hospital pharmacy. We need to buy it after the patient decides.
Gotcha. Yeah, it might be a tough question, but and because I don't know how much time you spent in the United States or other places, but what I mean, it's almost hard for my brain to fathom what it's like to live and exist in a country where it is acceptable as a therapeutic modality. So, I mean, are there other substances that psychedelic substances that are available to the population there?
Yes, mainly ayahuasca. Ayahuasca is the substance that it's born here in the Amazon, and so people are using this for centuries. And this is a reason why they accept ibogaine, because it's another psychedelic, and ayahuasca is accepted for a long time. Ayahuasca is legal here since you use it for ritual purposes. It's not allowed for us to use ayahuasca for therapeutic purposes. But sometimes the ritualistic purposes, they are therapeutic, so we can use. But this really opened doors for us to use ibogaine. But it was never scheduled, ibogaine, but people simply wasn't aware about ibogaine. In the last years, in the last 30 years, when I started working with it, slowly people were getting information about it. And it's interesting to see how nowadays there's a lot more people aware about ibogaine and accepting it. It's interesting to see that people in 20 years ago, for example, weren't accepting it, and now they are starting to accept it because Ibogaine works. Ibogaine works. My main experience is with addiction. Ibogaine works, so it's impossible for you to deny this. So that's why people that were against it in the beginning, now these people are starting to accept it and to wanting to learn about it. So I think that Brazil is doing a good job helping the world to understand Ibogaine and to show that it's possible to do safe Ibogaine treatments, to do it the right way with the right protocol, and to really benefit people. Because, like in the United States, as it's banned, as it is scheduled, it's difficult even to research it because it's so bureaucratic for you to buy it, to do the research. In Brazil, it's a little simpler. But we have other situations here, for example, like MDMA. It's forbidden here, like it's in the United States. We did a research with MAPS around 8 years ago, and it was super complicated to import the MDMA and to do the research. It took more than 1 year for us to have the authorization to import it. So Ibogaine is a special situation where it's not scheduled, so it makes things simpler for us to treat people and for us to do research. Other
Wonderful.
substances,
No.
other psychedelics are not liberated here, are not legal here. For example, magic mushrooms. People sell magic mushrooms even in the internet, but they are banned. But they say things like, no, we are selling it because it's food, but it's not exactly the truth. So it depends on the people that are seeing the site in the internet. If the people decides to create some kind of problem, they can create. But Ibogaine, it's not forbidden, and it's a little regulated here. And our work, what we are trying to do, is to fully regulate it here. Mm-hmm. What we are trying to do is to show ANVISA some research for us to go over this rule that you cannot have the stock here. Because if we could buy like 100 doses at once, the price would drop a lot and people would have more access to it. This is our short-term goal, to drop the price, to make it more accessible to people that need it.
Yeah, that is definitely a concern in the United States as well as other places where it's either gray area or attempting to be integrated into the medical system, particularly in the US and Canada. It is an interesting distinction, though, that ayahuasca, because ayahuasca is a combination of several plants and varies practitioner to practitioner, whereas Ibogaine is pretty clearly defined. It's an extraction from the Iboga plant. And it sounds like ayahuasca is protected under the kind of spiritual traditions, whereas Ibogaine is regulated, and you're seeking more regulation so that there's an availability for more people to experience it. In the context of the difference between Iboga and Ibogaine, is Iboga available there as well, or is it just Ibogaine that is regulated? And
no, at this moment, only Ibogaine, because Iboga or TA or PTA and other variations, they are a little more problematic. I believe in it. I respect this preparation. They work for sure. But from the point of view of the government and from ANVISA's point of view, it's a little more complicated because there's a lot of alkaloids mixed and they don't like this. They would ask, if we try to legalize it here, we would need to do individual research for each alkaloid to prove if they are safe or not. With Ibogaine, it's simpler because it's only one alkaloid, and most of the preparations that we have around the world of Ibogaine, they are more than 90% purity, 95%. So it's easier for the health agencies for them to accept this. Only one substance and not 12 alkaloids. That's why I don't believe that in the short term, other preparations would be legalized here. I think that Ibogaine will be the first and will be the one for a long time.
Yeah. And at the Vera Cruz Research Center where you practice, are you one of the only places that can do this, or are there many places in Brazil that have the ability to prescribe or make available Ibogaine right now?
Oh, there's a lot of underground places that work with Ibogaine, like in Mexico, and there are a few above ground, let's say, like us and like other places. There's a place in Bahia State that they do a very beautiful work there. But most of the Ibogaine clinics in Brazil are still underground because the problem is that they don't, for any reason, they don't respect that rule that you need to buy the medicine when the patient decides. They want to have the medicine with them to do the treatment very quickly when the patient decides, okay, let's go tomorrow. And we don't believe in this. We don't see Ibogaine treatment like a drive-through treatment. We think that it's a good thing for us to have this 4 weeks or 5 weeks to wait. We have time to do medical tests. We have time to do psychotherapy. We really believe that psychotherapy is very important to Ibogaine. We really believe that Ibogaine facilitates psychotherapy. So for us, we think that it's a good thing when we say to the patient that he needs to wait 4 weeks, but let's make this time worth. Let's do some therapy, let's do tests, let's prepare yourself. At the first moment, they don't like, but when they understand, they embrace the protocol and everything goes fine. Other places, and I respect the guys, but they are a little more in a rush to do treatments very quickly. And I believe they don't publish papers, but I believe that their efficacy is not so high that it could be because of this rush. To do an Ibogaine treatment, you must be prepared. It's a strong experience. It's a deep experience. It's not a thing that you take and let's see. You must have some information about what could happen, because sometimes it's complicated, even when you are prepared. Imagine if you are not. So I think that some places could wait a little and not do the treatment so in a hurry, but I have no influence on them, so everyone does what he wants to do. But I think that doing it slowly and not in a rush and preparing the patient at least a little works better for a treatment like Ibogaine.
Well, yeah, and also because you've got the track record. You've had 30 years and no deaths, which that is not true of many of the places around the world. Rushing through. I mean, I understand when we spoke at Philadelic, you see people for 24 hours, right? And then they have some sort of convalescing time, I imagine, and then they go home, right?
Exactly.
I mean, that seems fast, except I think it's way better to prepare and use the clinical time for the medical monitoring, understanding that, and then after they leave, are there support systems for them set up in Brazil? What does the sort of aftercare look like?
Yes, well, I am the Ibogaine doctor, and we have the Ibogaine psychologist. His name is Bruno too, is the other Bruno of the team, Bruno Gomes. I am Bruno Rasmussen, he's Bruno Gomes. We work together for more than 15 years. And he is the guy that prepares the patient, and after the treatment, that gives the aftercare and the support that patient needs. Some patients need more support, some patients need less, but it's interesting because a lot of times it happens that the patient is having a difficult experience during Ibogaine. And I arrive at the room and they tell me this, I'm having a difficult experience. Thanks God that Bruno warned me, the other Bruno. Yes. So that's the moment that we see that the preparation works, because they are really prepared for what can come. It's interesting. And about the deaths, we are lucky that it happened here. It never happened here. But sometimes, I think it's important to say this, sometimes this kind of thing happens, and it's not the team's fault. First of all, things happen. Things happen all the time, and people die going to the dentist and going in the street. And sometimes, unfortunately, the profile of the patients that we treat, sometimes they don't follow some recommendations, some safety recommendations. Like some people drive with no seat belts, and some people come to do Ibogaine using heroin or using fentanyl, and we ask them not to do this, but this is their problem. The problem of the guys is exactly that they cannot control. If they could control, they wouldn't be here doing Ibogaine. So because, you know, there are papers, mainly the Kenneth Alper paper, that shows that almost all of that he studied in that paper, the problem was subreptitious use of other drug than Ibogaine. So Ibogaine plus another drug, or even more drugs like Ibogaine, cocaine, and heroin, Ibogaine, cocaine, and alcohol. So sometimes even the provider doing their best, it's difficult to control. And sometimes people are being not too responsible as they could be. I understand. Sometimes there are mistakes from the team, but a lot of time the mistake is from the patient. So that's why we are vigilant. We are all the time around. And even to smoke, we ask the patient not to smoke nicotine. We ask them not to smoke during the treatment to avoid any other chemical that could disturb. Because when I started with Ibogaine treatments, we didn't know all that we know now. We don't know everything, but we know a lot more than 30 years ago. So we were super careful about don't mixing things. And it's working. So nowadays, sometimes we think, we question ourselves, am I being so restrictive? I am being too much restrictive, too much rigorous about this. But as it's working and nobody is having problems, and more than 70% are becoming abstinent for a long period, I think that we say here in Brazil that a team that is winning, we don't change. So let's go the same way. But by the other side, the protocol is a living protocol. So from time to time, we change details, but in its essence, it's the same protocol in the last 30 years because it's working.
Yeah, if it's not broken. Yes. And because it is regulated to the extent that it is, symptoms and or diagnoses are acceptable as the reason for treatment in Brazil. What?
Well, officially only addiction.
Okay.
But we can treat depression too and PTSD too. Because here in Brazil, people, the medical council, they respect a lot what they say, the medical or the doctor's autonomy. So the doctors is the person who decides. Okay. So they respect this. And sometimes the medical council, even they don't agree with what you are doing, but they respect if you really think that this is good for the patient. And as I said, the most important, if the patient agrees, everything is fine. So this is the window that we have to work. But there's, as everywhere, there are doctors here in Brazil that don't like Ibogaine. But when you talk with them, I don't like Ibogaine. Ibogaine is dangerous. And we say, okay, how many patients did you see? No, never. I never seen a patient treating with Ibogaine. So I normally invite them. So, come on, come to the hospital and follow a treatment. Be with us for 2 or 3 days to see some treatments. So what lacks is information. We need to educate the doctors, the health professionals about Ibogaine. There's a sensation that Ibogaine is more dangerous than it really is. It's not so dangerous. If you do it the right way, it's not dangerous. But the problem is that people sometimes don't understand what they are doing. Sometimes people want to help, and so they want to take Ibogaine or give Ibogaine to a friend, for example, but they don't understand exactly what's happening. So I always say this: if you need to do a small surgery, like if you have stones in your gallbladder, will you go to a hospital or do the treatment in a hotel, for example, with your friend and the kid's knife? So I am exaggerating a little, but just to say that people that deal with Ibogaine must be professionals. They must, and not only doctors, I'm not saying this, but people that understand what they are doing. When you understand what you're doing, things are safer. And not to put commercial interest in front of the medical interest. So sometimes you want to do a treatment, but the patient has a problem that you cannot. So you must be brave, the sufficient to say no to the patient. You are not fit to Ibogaine. I'm not going to do your treatment. This is important. And not to do all the treatments that look after you, all the patients to look after you to do the treatment, because there are some patients that are not fit for this kind of treatment.
Yeah, and on that note, how many people are you seeing per year?
Around 100, 150, exactly because of that. Around 25% of the patients that look for the treatment, they are not approved for the treatment, or for physical reasons, or for psychiatric reasons, like schizophrenia, complicated bipolarity, or things like that. So you must take it easy, and sometimes we make 3, 4, 5 consultations with the patient before deciding if he will be accepted, let's say, for the treatment or not.
I think this is really a poignant point because things are not regulated, gray zone, very difficult to monitor. One thing I'll say that, as far as I understand it, in the US at least, even if the people are doing it outside the US, they consider the death like it's responsible. It's being held. Ibogaine is being held responsible for a death, even if the person goes home and takes their normal dose of whatever it is that they were going to take, that they were trying to get rid of, or they take something that is contraindicated. Because the Ibogaine is still active in the system, it's considered a death associated with Ibogaine rather than the other substance. And there's very few that, and not to say it doesn't happen, but complications with the heart is usually what people are worried about, and the QT levels, but that is not often the reason for the deaths.
Exactly.
And it's fairly rare. And so, but it doesn't mean you shouldn't still have that 12 lead EKG and all of the preparation, and also the mental preparation. This is there's so much depth of knowledge in 30 years of your experience. We're just trying to figure out how we can bring a little tiny bit of it into the awareness of those that are in the legislative bodies, the medical boards, the people who are considering this for America, Canada, and other places. Europe would love this as well. But the main challenge that I think a lot of people have is that they want it because they hear it's the magic bullet. It's going to alleviate every single thing that's wrong with you.
Exactly.
And you and I both experienced the medicine. You've experienced Ibogaine or Iboga or both?
Yes, no, both. Ibogaine, HCl, and root bark.
And root bark. Okay.
Yes.
I've only experienced root bark, TA, and some Iboga tea. So I haven't done Iboga or Ibogaine pure, but it really does require a lot of mental preparation because it's a mind-oriented experience. Your body is definitely involved.
Yeah.
But more so than, I would say, a lot of the other substances that people are very interested in. And it's also, as a person who is a recovering marketing professional, I'm trying to be, I recognize the nature of suggestion and also hype that comes around these substances, and the idea that we're perpetuating that these it's one and done. Get in there, be done with it. It may clear your system to a certain degree, but it doesn't always. So I'd love to hear, I know that you treat pretty acutely for methamphetamine abuse, correct?
Yes, normally here in Brazil, we have more patients from cocaine and crack cocaine than from heroin. But we receive patients from methamphetamine too. There is a scene of methamphetamine use in Brazil. You do this. Sometimes people come from United States from methamphetamine for methamphetamine treatments, or for heroin or fentanyl treatments. But the most patients that we treat they are from cocaine use and crack cocaine use.
Yeah. That's sort of to be expected because there's so much produced in South America, but
Exactly, exactly,
yeah.
is that.
Yeah,
And
which do you find you're seeing mostly cocaine and crack cocaine, but which ones tend to be the hardest that to clean up, to support in your experience? I mean,
yeah, crack cocaine patients are the most difficult because of the environment that they are. Crack cocaine really disturbs your normal life. It's not almost impossible for you to use crack cocaine all the time and stay working, stay studying, stay with normal relationships. So when the patients arrive to the treatment, their lives are so disorganized, are so complicated that they are more difficult to get back to but by the other side, this is less dangerous than doing opiate treatments because with cocaine and crack cocaine, we can ask the patient and help them to stay away from this for some time. But with opiates, we cannot. The biggest time that we can ask the patient to stay without opiates is for like 10, 12 hours. So, and Ibogaine is known for raising the toxicity of opiates. So you have opiates in your system and you take a substance that makes it more toxic. This is the danger. With crack cocaine, the problem is in the first days because when you stop using cocaine or you stop using crack cocaine, there is this enlargement of the QT interval just because you stop it. So if you take Ibogaine at the same time, it's a big problem. So that's why we ask the patient to stay away from cocaine and from crack cocaine for some time. The ideal time would be 4 weeks. And when we say this, normally people say, wow, so it's impossible to treat patients because they cannot stay.
exactly.
No, they stay. The patient that really wants to do the treatment, the patient that is really motivated, he agrees. He embraces the protocol. And even if he needs to be in a clinic, in a rehab for some time, they embrace the protocol and they arrive here totally out of cocaine or crack cocaine. And I think that is one of the main reasons that we don't have big problems here because they arrive detoxified. So it's easier to deal with them. You see other clinics around the world, they receive the patient today and they give Ibogaine the next day. So the patient sometimes have a lot of other chemicals circulating. This is the problem. So it's important for the patient to arrive. I don't like this word, but to say it in English, it's important that the patient arrives as clean as the most clean that he can, because this will bring safeness to the procedure.
Yeah, I mean that's just a clarification. Do they come to the center and stay for 4 weeks before, or you're in contact with them 4 weeks before so that you can kind of monitor them? Is that
Yes, we stay in contact with them, and normally, if they need, they can go to a rehab. We have a lot of rehabs all over Brazil. There are partners that can receive the patient there, and these places helps us with the business. And when the patient is at home, normally we monitor them with the help of the family with weekly toxicological tests. And when they arrive here, we do, right before taking Ibogaine, we do a last toxicological test to be sure that at least for the last days, they weren't using anything. This prevents complications, I think.
Yeah, that's an interesting point too. I think something that, particularly because again, people are having to exit the United States in order to get access, even if they come from a rehab, something that, and I'm not sure if this is true there, but because we are so pharma forward, shall you say, oftentimes people leave rehab center on more substances than they came in on, because the
Yeah.
one that is illegal is the one they're trying to stop, but they come out on an SSRI, benzo, several things, the anti-anxiety, gabapentin, so many things that are not going to support going into Ibogaine, because that's not the point of our rehabs, you know? So
Exactly.
I'm curious if the rehabs there also actually get people completely clean off substances, or if they also are, do you find that they tend to prescribe other things while they're under their care?
Yes, that's why I said there are some rehab centers that are partners because they understand
Yeah,
and they help
you
us.
have your list.
Exactly. Exactly. But there are other that are the opposite. So they don't want to help with Ibogaine. So they really prescribe a lot of medications. And sometimes when the patient arrives to take Ibogaine, we we find that they are using a lot of things that wouldn't be safe, and we must postpone the treatment until they eliminate. Like, as you said, SSRIs or a lot of benzos sometimes, benzodiazepines or other antidepressants or anti-anxiety drugs. There's a lot of psychiatric drugs that could interfere with Ibogaine. And there are two kinds of psychiatrists. There are the psychiatrists that understand Ibogaine and want to help, and there are the psychiatrists that really want to, they really don't want to participate, they don't want to help, and they say, I don't have anything with this, I will prescribe whatever I want, and when the patient arrives, you solve this, it's not my problem. But we try to, as we know, most of these guys, we try to choose rehabs for the patients to stay. And there's another problem because normally rehabs like to the patient to stay there for 9 months, 1 year, 6 months. And with Ibogaine, we need at most 1 month, 4 weeks. So some rehabs don't like Ibogaine because of commercial reasons. They don't want to lose the big time of being there.
Yeah,
Yes,
that's
so
the
we must choose
interesting
carefully
quandary.
the partners.
That's the balance between the commercial and the healing. Yeah,
Exactly.
it's interesting because in the United States, we have usually a 28-day, 30-day stay. That's usually what's covered by insurance. We're bound by a lot of the insurance carriers. The vast majority of the most successful people going through rehab are those that are incarcerated because they have access for 6 to 9 months to continued rehabilitation.
Mm.
Care for substance abuse and other rehabilitation different, but it's very curious because we just do not cover that. We don't cover the ability for people to even stay that long. Private private providers, yes, but those come at the cost of $100,000 usually for a month. So that adds up pretty quick, as you can imagine. So these interventions, these opportunities are often not even available. And so the ones that actually support the long-term care. So I mean, it's so fascinating to witness because I'd love to come visit Brazil and understand, and I probably will, frankly, because I love traveling, but to understand what it's like to live in a culture where this is available. Flip side, of course, obviously it's necessary. So there's a cocaine and crack cocaine problem, which I don't know. Being in Philadelphia was a very interesting experience because they now have something that is infinitely worse called trank. Have you ever heard of this particular
Trank?
trank?
No, no, I'm not aware about
That's
this.
its street name, and I don't know how to pronounce its real name. It starts with an X. Its
Mhm.
pharmacological name, but it is a substance that's more potent than fentanyl, as far as I understand, and it's in 90% of the street drugs there. And it is something that my brain almost couldn't understand because I've dealt with a lot of folks with heroin abuse and needle IV drug users. I've known and worked with them. There's always a risk of having an abscess where the injection site because of the dirtiness of the drugs. This actually, the nature of this drug dissolves soft tissue. So it makes these huge abscesses and dissolves the muscle down to the bone at the injection site. But as you would suspect by the name Trank, it's a tranquilizer. It is incredibly potent, and it takes a while to graduate to that point of desiring something that strong. It seems like if we don't do something pretty extreme, we will continue to see, at least in the US, I can speak because I'm a US citizen, I live in Mexico, but it sort of shocked me to witness that being to that extreme, that people are going to that extreme to numb, to try and it people don't come to these substances with they might do some cocaine for a party, maybe. Crack cocaine's a graduated substance. Heroin, you don't tend to start there. People might, but heroin to fentanyl, graduated. These are such extreme substances, and then going beyond that from fentanyl to something even more intense. The problem's getting bigger. Having access to your research, people understanding about what your work is, the safe context that you've placed it in, the protocols that you've created. I mean, it's so incredible. Thank you so much for sharing even the small portion, because we could dive way deeper for sure. But I would love to know if there's anything that you could share, knowing what you guys face as a country, if there's anything that you could share, if you had the ear of a legislator or someone who's trying to truly offer a resolution or at least really intensive recovery for some of these substances. Is there something you can share in terms of recommendations for the legal process or how to support people in the medical field? Anything and everything is welcome.
Yes. No, what I would like for the legislators to know is that from the medical point of view, using drugs, not any drugs, but the most complicated drugs, let's say, as you said, from cocaine on, cocaine, crack cocaine, heroin, fentanyl, and this strength, it's a way more dangerous than Ibogaine. So
Thank you.
Yes, as we see here in Brazil, what's most dangerous? Going to the hospital and staying there for 24, 48 hours under Ibogaine, or going to a hotel and stay there 5 days taking grams and grams of crack cocaine. It's obvious. So this is the problem. We are dealing with a complicated thing. I always say this, we are not suggesting a new treatment to fever or to a small flu or things like that. We are dealing with a very complicated disease, a very complicated problem, not a disease, let's say, but a problem. You can imagine how suffering these people is to take this strength, knowing that their flesh will dissolve there, but even they are taking it because they are suffering a lot. So it's important to have this understanding that a lot of medical procedures are dangerous. A lot of procedures are dangerous. For example, during a bariatric surgery, cutting your stomach to lose weight is super dangerous. There's a high mortality about this. But officially, we do not do this only for aesthetic reasons. We do it to protect the patient from diabetes, from arterial hypertension, and other problems from the obesity. So that's the same thinking. It's not as safe as an aspirin, for example. Ibogaine is a little more complicated, but it's not so complicated as the problem that is leading the patient to the treatment. So doing it the right way, it's safe, it's a good thing, it helps a lot. So I think that the legislators, they are worried about promoting or legalizing a thing that in the future they could be like feeling guilty if something bad happens, but they must feel guilty about doing nothing. And a lot of people dying all the time. People are dying all the time, mainly in the United States after the beginning of this opioid crisis that you have there. Thousands of people are dying. So, and we have a safe treatment, and it's safe as it's done the right way. To drive, it's dangerous. To drive, to go to the road in a car, it's dangerous. But with the proper behavior in the road, everything goes fine. So it's the right thing. It's the same thing. So I think my advice would be, think this way. Think this way. We are dealing with a complicated situation. We are not trying to treat a simple problem. We are trying to treat a very complicated problem. And it's like a biological reaction. So if you give some drugs to a rat, they will become addicted. So it's not so simple. Sometimes people start with this just to see how it is, and after some weeks, they are totally lost in this. So we must pay attention to this, because a thing that I see is the people, when people say, oh, this people is addicted, people has a wrong viewing of this. Most of the people that are dealing with this are super good people, nice people. I gained a lot of friends, new friends after the treatments, because people are great. They are dealing with a problem. Some people have problems in the liver, some people have problems in the lungs, and some people have this problem with substances. So let's treat them. Let's treat everybody that needs and that wants. I think this. So doing nothing is more harm. Doing nothing will cause more harm than releasing and legalizing Ibogaine treatments.
100% agree.
Yeah.
Absolutely. It is so beautiful. I have spoken to medical professionals who've only been medical professionals for 10 years, and they don't have the passion that you do. They've unfortunately their fire's gone out. It's so evident that you are passionate about what you do, and you really actually have results that are so clear. And it's beautiful that you also have, because you're at a research center, have that documented. So I am just so grateful for your time today, and for sharing your wealth of knowledge. I really hope, and will do my very best to get this into hands that can hear your message, because it feels like it's not the magic bullet, but it's better than doing nothing. It's safer than keeping things as is. And
Exactly.
and the methods that we've tried, they just haven't worked. We need new methods. We just simply do. And this is available. It's reasonably safe. I can step off a curb and be hit by a bus too. So, life has inherent
Exactly.
risks, but I can
Exactly.
say, Iboga has been incredibly supportive in my world, and obviously you've helped thousands of people at this point. So it's not an experimental treatment at this point. You can't
Exactly.
call it that
Exactly.
anymore. We really can't pretend like this is experimental. It's just getting the information to the right people. So thank you so much for your time, Dr. Bruno.
Thank you. Thank you. I thank you. I'm very honored to participate in this, and I'm at your disposal. If you want to chat more, I'm here. Just
Oh,
let me know.
thank you so much. I really, really appreciate it. And we'll be in touch. And is there any way that, I mean, obviously you're a very busy doctor, but is there a website or someplace people can reach you, or if they are in Brazil, or maybe they can travel to Brazil to apply, how would they go about doing that?
Well, if someone wants to talk with me, can look at my Instagram, which is at Bruno Rasmussen Chaves, and the Chaves is with an S in the end, Chaves. So
I'll link
Bruno
it in the
Rasmussen
description.
Chaves, all together.
Okay.
I'm there. Just send me a message, and I will answer very, very quickly.
Okay, fantastic. Thank you so much, Dr. Bruno.
Thank you. Thank you. See you.